If you're speaking specifically about RFK Jr., I think you could go back about 20 years. Actually, a host on Bloomberg Radio recently, Paul Offit, who's, for me at least, one of the most respected vaccinologists around, and is on the advisory committee, etc., for vaccinations. He, I think, had an interview with him or had a conversation with him about 20 years ago, after which there was a publication where his very strong, RFK Jr.'s very strong views were espoused. But generally, vaccine hesitancy, vaccine questions, as we all know, have been around like any other medicine, really. As soon as something is available. Right now we have obesity drugs, and lots of people are questioning about obesity drugs. So any new product, any new technology that comes along, there are skeptics. And sometimes that's very useful because it pushes you to think harder, to make sure you have the data and the science backing the risk-benefit ratio. That is the critical element of any intervention that we do in our lives, risk-benefit ratio. So,
is there any concept that this sentiment is on the rise, or sort of what effect can we think that it has in terms of public health?
Yeah, there is evidence that the view of particularly parents with regards to childhood vaccinations is in terms of negativity is rising. And if you think back, we had that pseudo-scientific paper that was published quite a long time ago suggesting that certain vaccines lead to autism, which was, of course, the study was flawed, the statistics were flawed, the analysis was flawed, and that's been proven over and over again. So, but there is a tendency, and there seems to be an increasing attitude toward, I don't want to expose my child to whatever it is that people think that they're doing negative for their kids, which of course is, as far as I'm concerned, super dangerous. I've got some stats for you on measles that we can talk about if you wanted to.
Well, because that's one of the ones that the WHO has particularly been warning about.
Yeah. I mean, so in the past, in 2023, I mean, the data, 2024 is still, we're in it, right? 2023, there was a 20% increase in the cases of measles. Now, remembering, vaccines don't prevent infections. Vaccines prevent disease. And I think that's one of the things that perhaps people got a bit confused about. During COVID, you get your vaccinations, and a few months later, you still get a COVID infection. You go, well, why did that happen? I think perhaps we didn't communicate very well. But so let's say measles. This infection, 20% increase, could be a statistical fluke, but let's see how 2024 turns out. But there's definitely a trend toward increases, and we've heard stories around the UK where there are outbreaks, and there have been some cases. But let me just say, before the vaccine came through, 2.6 million people a year were dying, 1963. Imagine what their world population was at the time. Now, much larger. And so far, last year or this year, we've only had 107,000 deaths. Only, I mean, that's obviously a single death is bad. But so this is something where vaccines really stand out in medical treatments.
For people who are hesitant or unsure about vaccines, how much trust can we have in the process that leads to their approval? This was part of the conversation around COVID as well. It appeared that the process moved much quicker in that case.
Yeah, I mean, don't forget, COVID, we were in a pandemic. God forbid we get a situation with smallpox again. Let's say, and I'm not saying it will, let's say Mpox becomes the new smallpox, right? What are we going to do? We have to get vaccinations out as fast as possible to prevent the ultimate millions of deaths that will occur. That is a very specific period. So COVID was a very special situation. People should not assume that. Vaccines used to take years to get to market previously, and they continue to be the case now. That was a special period. Vaccines go through significant rigor because by definition, you're giving something, a medical intervention, to a healthy person. So you need to be absolutely sure, as much as humanly possible, of its safety.
What can be done then to counteract the sentiment? If we can place more emphasis on the rigor of these approval systems for vaccines to trust people they're safe, is there more messaging that we can do to ensure people know and can trust in vaccines? I
think good, high-quality scientific messaging that is acceptable, understandable by people, not bamboozling them with strange terminology and data, and really just highlighting the sorts of stats that are just given. 1963, 2.6 million deaths. Last year, 107,000 from measles. These are facts that people need to know. It's not that measles virus has disappeared. The viruses always stay with us in some form or another. So that's the question. I mean, we have got rid of one, which was smallpox. But this is what people need to understand. Let's give them more information and be ready there to coolly converse with folks who are skeptical.
How much influence could someone in charge of the Health and Human Services Department in the United States have on vaccine uptake if the messaging is coming from a different point of view?
Significant. So, I mean, even if the FDA approves a vaccine, I think the head of the HHS can have an influence on it actually being able to launch, actually being able to use. So this is a very powerful position. And I'm hoping, given that RFK Jr. has some very good views about food additives, the types of food that are consumed around, that logic will prevail over mythology, if it's the best phrase I can use.
Part of your day job is researching pharmaceutical companies, and I wonder how they approach this issue of hesitancy around uptake of vaccines.
Yeah, look, pharma companies are there to make a profit. They're there to get their product to market faster and keep it on the market for longest. The agencies, the FDA, the European Agency for Medical Regulation and Approvals, etc., they are there to gatekeep. I'm not saying pharma companies do bad things, but there is a significant barrier between a company who's incentivized to get its products to market, which in a majority of the times they do with good conscience. There is a barrier. There is a significant filter with the public. And that's what these agencies are for. That is where we hope that the HHS and the new administration that's coming into the US doesn't undermine that ability. Yes, remove red tape, but don't undermine the critical nature of their work, which is safety.